New at 5, WGN investigates as the results of a scathing new audit of the Illinois Department of Children and Family Services.
It comes after we have spent the last several years documenting significant problems in the agency and concerns about whether it's living up to its mission to protect vulnerable children. Investigative reporter Ben Bradley is here with the story.
Jackie and Ray, while we've reported on heartbreaking specifics such as kids forced to sleep on the floors of state offices and children who are hospitalized longer than is medically necessary, this new report from the Illinois Auditor General looks at the broad issues that are crippling DCFS, and they include not having the most basic information about how kids in crisis are being cared for. When Illinois' Child Welfare Agency makes mistakes, kids can die. 2-year-old Tanaja Barnes is among them. The Central Illinois toddler died in 2019 due to dehydration, malnourishment, exposure to the cold, and neglect, months after DCFS returned her to the care of her mother and closed the case.
Today is only the first step in many to come.
A state law governing DCFS was renamed in honor of Tanaja, but the Illinois Auditor General found the agency is not living up to the little girl's legacy, let alone its mission to protect kids. The audit found DCFS was unable to provide required home safety checklists in 98% of cases reviewed. 58% of the cases didn't have at least 6 months worth of documented aftercare services.
This is one of the main things that we do as a state, and it's our job to protect the children. In this case going forward, it needs some improvement.
WGN Investigates has been documenting DCFS's shortcoming for years. In 2019, we showed you how more than 100 kids that year were forced to sleep in state offices, sometimes for several nights, awaiting appropriate placement. Is that ever supposed to happen?
No, never. That's why we have emergency shelters.
The governor and DCFS's director responded to our report by promising action.
It's unacceptable that we have kids who are forced to sleep in a makeshift conference room / sleeping area when we should have the shelter beds available.
For me, it is unacceptable for a child to be in our office without a safe, nurturing home for any amount of nights.
But 2 years later, we found DCFS simply rented unlicensed shelter space from private agencies to store kids.
It's still happening. It's worse now.
Also last year, we introduced you to Morgan, a former ward of the state, among hundreds of kids left stranded in psychiatric hospitals far longer than medically necessary because DCFS had nowhere else to put them.
You're only supposed to be there for about a week or 2 weeks. I was there for 3 months almost each time, and I went to the hospital like 3 times.
Simply staffing DCFS has been a struggle for years. In January, child protection specialist Deidre Silas was stabbed to death downstate while responding by herself to a report of kids in danger.
She loved her job. She loved kids. And that's one of the main reasons why she did that job.
The Illinois Auditor General found 21% of the agency's funded positions were vacant, and its organizational chart so confusing it was unclear which positions were even necessary.
So 1 in 5 people that would be charged with taking care of these children who find themselves in this situation through no fault of their own aren't there. That's an overriding problem.
A DCFS spokesperson tells me that since the audit was conducted, hundreds more workers have been hired and 97% of funded positions are now filled. But the agency is dealing with an onslaught of new cases, now averaging 1,000 more cases per month than just a couple of years ago. So staffing continues to be an issue. As for their inability to track some aspects of kids' care, well, they've invested in a new computer system that's supposed to help with that and do a better job. But, and there is a but, right, Ray? That computer system is not going to be fully operational for 2 more years.
Oh my.
Yeah.
And, this is something that they have responded to. They said that they are already working since the audit was completed before it became public.
Yes, so they say they have addressed some things. The Auditor General made a couple of key findings. They have staffed up, but with more cases comes the need for more staff. So there are still significant issues. A lot of them are structural with how this agency has been run for many years.
More cases because of the pandemic?
More
Ron,
cases
assume?
because of the pandemic, yeah.
Thank you for the update, Ben Bradley.